today also we will continue the terminology of the obstetrical gynecology. So today's first terminology is lie. So what is this lie? It is the relationship between the long axis of the fetus with respect to the long axis of mother. Okay. So it is the relationship between the long axis of the fetus with respect to long axis of mother. What is this long axis? It is an imaginary line from head to foot of the fetus and mother. So the relationship between the long axis of the fetus with respect to the long axis of mother, which is the term is using for that is lie. There are three types of lie is there: longitudinal, transverse and oblique. Longitudinal, transverse and oblique. Okay. So what is this longitudinal? Longitudinal means the spine of the fetus will be runs parallel to the spine of the mother. Okay. It will be parallel. So the spine of the fetus runs parallel to the spine of the mother. Parallel it will be. That is known as longitudinal. Okay. And another is transverse. Transverse is horizontally. So if it is a uterus, what will happen? The baby lies horizontally rather than vertically. That is known as transverse. If it is a uterus, this one, the horizontally the baby will be lies inside the uterus. That is known as transverse lie. And another is oblique. In the oblique condition, what is that? It will not be parallel or horizontal. That means it is not be a longitudinal or transverse. What will happen? The body and head of the fetus will be diagonal, or the head of the fetus will be lies in the hip of the mother. So these are three types of lie. And I will draw the picture, you will get an idea what is longitudinal and transverse. So here the picture for the longitudinal lie. So this is the picture for longitudinal lie. You can see the baby lies parallel to the spine of mother. So this lie is known as longitudinal lie. Here the picture for transverse lie. Okay, so you can see this is the uterus and baby lies horizontally rather than vertically. This lie is known as transverse lie. If it is uterus, the baby lies horizontally. Okay, so that is transverse lie. Next terminology is attitude. So attitude is the word which is used for the relationship between the different parts of the fetus during the time of delivery. So the normal attitude for the fetus is flexed attitude. So what is this flexed attitude? You can see the head of the baby will be fall towards the chest of the same fetus. Okay, and also the other bones will be very flexible to come out of the pelvis of the mother. So what is the use of this flexed attitude means the baby can make themselves the diameter very smallest and they can come out of the pelvis easily. So that is known as attitude. Next is engagement. Okay, engagement. So what is this engagement means? It is the process of the widest part of the fetus enters to the pelvic brim or the pelvic inlet of the mother. So the widest part, of course, it is the head. Okay, so once the widest part of the fetus enters to the pelvic brim or the pelvic inlet, that process is known as engagement. So this engagement normally occurs the 2 weeks before the birth. That means approximately over the 38 weeks of gestational period. Okay, so what is that? It is the process of the widest part of the fetus enters to the pelvic brim or the pelvic inlet, that is known as engagement. Another terminology is moulding. So moulding is the process of reducing the diameter of the skull. So reducing the diameter of the skull without making any damage of the brain, that process is known as moulding. So the moulding process occurs due to some characteristics of the skull. So let's see what are these characteristics. The characteristics is ununited sutures of the skull. Okay, the ununited sutures of the skull will move together and overlap. It will be the ununited sutures of the skull will be moved together and it will be overlapped during the time of delivery. So it will helpful to reduce the diameter of the skull and it will be easy to come out of the baby from the pelvis. And another characteristics is the nature of the bone is compressible. So the bones are not much rigid, it is flexible and it is compressible. That is also another characteristics which is helping for molding. And another is the presence of the anterior and posterior fingernails, which will help for flexible of the bones, and all these three characteristics make the process molding very successfully. Effacement. Effacement is the process of the cervix become stretches thinner and the length of the cervix become shortens, and it will become the part of the lower segment of the uterus. That is known as effacement. So effacement is the process of the cervix become stretches thinner and the length of the cervix become shortens, and until completing this effacement the cervical dilation will not occur. What is the cervical dilation? Cervical dilation means the opening of the cervical os for the delivery. So this is the effacement. The cervix become getting ready to deliver the baby by stretching and making the wall thinner and length become short, and it will become the part of the lower segment of the uterus. Episiotomy. Episiotomy is also called as the perineotomy. Episiotomy or perineotomy. It is one of the surgical incision making on the perineum or the posterior vaginal wall. Okay, so it is one of the surgical incision making on the perineum and the posterior vaginal wall for making the baby to come out of the pelvis of the mother, and it is doing at the second stage of delivery. Okay, episiotomy or perineotomy. Another terminology is crown to rump length. So crown to rump length means it is the measurement which is taken for the fetus from head to buttocks. The measurement of the fetus which is taken from head to buttocks is known as crown to rump length. Another is Chadwick's sign. What is that? Chadwick's sign. So Chadwick's sign is the dark blue or purple color of the mucosa which is present in the vagina and cervix during the time of pregnancy. Which one? Dark blue or purple discoloration of the mucosa which is present in the vagina and cervix during the time of pregnancy is known as Chadwick's sign. NSVD. So NSVD is using for normal spontaneous vaginal delivery. And another is SVD. SVD is also same as the NSVD, that is spontaneous vaginal birth. Another word is Scissoring section. Scissoring section is the delivery through an abdominal incision rather than vaginal delivery. What is happening in this? The incision making on the abdomen and taking the baby out of the uterus. That process is known as Scissoring section. Primary Scissoring section. What is this primary Scissoring section? That means the mother has delivered a baby by Scissoring at first time. That is known as primary Scissoring section. The Scissoring occurring for the mother at first time, that is primary Scissoring section. And secondary Scissoring section, the mother had already the previous history of Scissoring, and the second time also it is repeating the same Scissoring delivery, that is known as secondary Scissoring section. Primary Scissoring section and secondary Scissoring section. Vaginal birth after Scissoring. So what is this vaginal birth after Scissoring? That means the mother had already the history of Scissoring section, but now what happened? They delivered the baby vaginally. So that is known as vaginal birth after the Scissoring. The previous had the history of the Scissoring, but now the baby delivered by vaginally. That is known as vaginal birth after Scissoring. Trying of labor. Trying of labor. So this trying of labor means already the mother had a history of Scissoring section. The first time they had Scissoring, but the second time what they are doing, they are trying for the vaginal birth. That is known as trying of labor. But there is a small amount of risk for the trying of labor. What is that? Already they had the history of Scissoring section. So sometimes there will be a chance for rupturing the previous surgical scar of the uterus. So the mother should be told about the risk factor for this trying of labor. So you should get the informed consent from the mother. VAD, that is vacuum assisted delivery. It is also known as ventouse, okay, ventouse, and it is doing at the second stage of delivery. What is happening in this vacuum assisted delivery? There is an apply of the suction cup over the head of the baby and gently draws the baby out of the uterus. When it is doing, when the mother is very weak, they cannot push out the baby from the uterus, this vacuum assisted delivery using. So if you have any doubt, please write in the comment box. I will explain if you need it again. And if you are watching the channel without subscribing, don't forget to subscribe for more detailed videos of this OBG. Thank you.